The start of the pandemic meant all hands on deck from our frontline healthcare workers, but it also impacted people studying to be healthcare workers. Education innovation became important to make sure that our nursing shortage didn't get any worse. Jeff Todd with more on this story tonight for us. And Jeff, you got an inside look at how training nurses has changed during this time.
Karen, when we think back to the beginning of the pandemic, there was so much we didn't know, but one thing hospital officials did know is that they would need as many nurses as possible. At HealthONE, they brought in an extra 125 nursing students to get them the education and training that they need, and they did it in high-tech fashion.
Madison's going to go ahead and read the story, and you also have a patient chart.
He has 24-hour history of fever and a hacking cough.
These nurses are from different facilities in the HealthONE network. They had not worked together before this training.
What's going on? Can you tell me how you feel?
I feel awful.
These scenarios walk us through difficult situations that we don't see often, so when we do see them, we're more comfortable.
When did that cough start?
Oh, a couple days ago.
Practicing in a pandemic looks and feels a little bit differently.
Madison Fliedner has only been on the job 5 months at the Presbyterian St. Luke's Blood Cancer Unit.
No tests for COVID.
Training like this
I'm gonna start CPR. 1, 2.
has already helped patients.
I knew right away because of that simulation. I was like, he's going septic. And I called the doctor and I knew what to do. And it made me a lot more comfortable with the situation, for sure.
These nurses needed new and different training because the pandemic interrupted the end of their education.
There is a nursing shortage. It's not a problem that's going to solve itself. We couldn't hit pause on something so very important.
End scenario. Let's go to the debriefing room.
I think new nurses can feel very alone in their residency as a whole. You have other resources, and I think that's been very helpful for me.
We're told this type of training has really streamlined processes for nurses and clinical staff throughout the 8 hospitals in the metro area and even more facilities that HealthONE operates. We're told that was vital to get through the pandemic. We're live in Inglewood tonight. Jeff Todd covering Colorado First.